talk about plastic surgery. Now, plastic surgery used to be Hollywood's dirty little secret, but now, of course, it's more mainstream than ever. And not only do we all tend to gossip about whether or not this celebrity or that celebrity has had something done, but we also wonder about our own neighbors and coworkers and friends. So today we've brought back our good friend, Dr. Yoon. Please welcome Dr. Yoon.
Thank you.
Yoon is going to do something really fun. He's going to teach us all the little clever ways we can spot if somebody's had a little something done.
Exactly.
Yes. Well, first of all, I want to clear up something that one of those rags wrote about me. They said that I had a brow lift. Now, I am not adverse to the idea. I'm not against the idea of getting anything nipped or tucked, but let me tell you, if they gave me enough time off to actually tuck, lift, or remove something, it would have been my butt, not my forehead. So, Dr. Yoon, I want you to do whatever a doctor needs to do to say, as a doctor, I definitely have not had a brow lift.
Okay, so let's take a peek. Oh, what's this? No, I'm just kidding.
Thanks a lot.
I say, as a board-certified plastic surgeon, I will stake my reputation that you have not had a brow lift.
Thank you. See that?
I don't see anything there.
Nothing under the hood. No brain, no nothing. Okay, so now, this really is so mainstream. It's no big deal now, right?
No, I mean, everybody seems like they're having plastic surgery nowadays, but a lot of people still aren't admitting to it. So what we're going to go over today is how can you spot plastic surgery, not so much necessarily on celebrities, but also on your neighbor or even your best friend.
Okay, so we're going to be spilling the secrets here. What's first?
So
what
the
are we
first
going to
thing
look at first?
is how can you tell if your neighbor or your friend has had a facelift, okay? The number one thing we look at is the neckline. A facelift will tighten up the neckline, and anybody who's over the age of 50 or 55 should have a little bit of what I call a turkey gobbler neck. If you look at them and they have a completely sharp jawline, there's a good chance they've had a facelift.
Aha! No such thing as a non-gobbler over 50.
It's not just a little fancy moisturizer that they claim. Now, I've actually got a picture of somebody, and let's show it up here. And this is a woman who is one of my patients in my office back in Michigan, and she's 65. Okay, and she shows the aging of a normal 65-year-old woman. And this is what we call that turkey gobbler neck, all right? And a 65-year-old should have that. That's a natural look, as well as a little bit of jowls and that type of thing. So I did a facelift on her.
That's these little things up here, little piggy jowls.
Exactly.
Yes, you get the whole barnyard going.
Yeah, exactly. Yeah. So I did a facelift on her, and this is her afterwards. And you can see now.
Wow.
Thank you. Now her neckline is nice and tight. There's none of that turkey gobbler.
You know what's so great,
jowls
though?
are better.
Maybe you can tell, but I would not be able to tell that. It looks very natural.
Well, that's the sign of a good plastic surgery, a good facelift, okay? Now, if somebody is 65... If somebody is 65...
We'll leave his number on our website.
If somebody is 65, she should not look that good, okay? And that's the thing. That's how you know. I meet women all the time, and it's that socialite that has a perfect skin, and you wonder, how do they look so good? You know, I know they're 60 years old. They've had a facelift.
That's why.
Okay.
Well, I think it came out great. Now, where do you put... when you take the gobbler and the jowl off, where do you put it, and where do you sew it up?
Well, that's the next thing we're going to cover. So the next sign of a facelift are scars. And every single facelift creates scars around the ears. And those scars, when I do it, are usually nice and well hidden. But there are a lot of kind of quickie facelifts out there. This is not my patient. I did not do the surgery, okay? So just to let you know.
Yeah.
But you can see this is a scar from one of those lunchtime quickie facelifts. And what can happen is you can see these. Now, if you're wondering if your friend has had a facelift, the thing you do is you say, hey, those are pretty earrings. Let me take a peek at those. And while you're looking at them, look around their ears, because you may be able to spot the scars of the facelift. Okay? So
there's a lovely earring there.
Nice. So that's one way you can tell. And the other thing that you see here on her picture is look at her earlobe. Okay? It looks kind of strange. And it's not a cauliflower ear like wrestlers have. This is what I call a raisin earlobe. It's a wrinkled up, funny-looking earlobe. And that's the same type of thing that you can get when you have a facelift that's botched. So if you're wondering if somebody's had work done...
They twist up the lobe.
Yeah, because sometimes we'll actually detach the lobe and put it back on. And if they don't put it back on right, it will look kind of strange. Okay. So staying with the earlobes, there's another sign. It's called a pixie ear deformity. Okay, we got a picture here. And this is a patient who has a pixie ear deformity. Whenever you have a facelift and the skin is pulled real tight, if the earlobe is not placed right, it can literally pull that earlobe all the way down. So now we're going to cover two celebrities who've had facelifts, okay, who've admitted to having facelifts. And one of them, I think, looks fantastic. The other one, we'll see. The first one is Sharon Osbourne, okay? And Sharon Osbourne, she has admitted to having a facelift done. And this is a picture of her when she was younger. And we also have a picture of her after her facelift and some other surgeries. And she looks great. And you can see the jawline looks good. Her earlobe isn't pulled all the way down here. She really looks great.
She does look terrific.
Now, one thing people wonder, how would somebody look like who's had plastic surgery like Sharon if she never had anything done? And there are companies out there that will actually age progress photos. So we did that with Sharon. We thought it might be kind of fun. How would Sharon look like had she not had any work done?
Don't do that.
And this is
I don't think that looks like what Sharon would look like at all. That looked like Mrs. Doubtfire. It does look like Mrs. Doubtfire. Totally.
So Sharon is a good example of good plastic surgery and how somebody can really benefit and look better afterwards.
Gotcha.
Now there's somebody else out there who some people would argue may not be as great of a person for that, and it's Joan Rivers. Now I love Joan Rivers.
I love Joan.
I do too. I was one contributor to her book on plastic surgery.
Don't you mess with Joan.
So I have nothing against her.
And Joan has been very open about the fact she's had an enormous amount of plastic surgery.
And she has admitted to having had a facelift followed by 3 subsequent surgeries as well. And for somebody who's 76, that's quite a bit of work. So let's take a peek at her photos. This is a picture of her before anything done, and this is a picture of her now. And you know, does she look better? Does she look worse? Well, let's take a peek at her had she not had anything done, and let's compare that. And that's what we age progressed her for. So, you know, some people may say they don't like the plastic surgery she's had. Arguably,
actually, I don't think that looks bad. I think it would bother Joan.
Exactly. I mean,
knowing Joan Rivers,
this is a normal 76-year-old woman, and Joan obviously is not a normal 76-year-old woman.
No, and I think that it has to do with how you're mentally at your best.
Exactly.
But nobody makes me laugh more. She's good for all my lines. I like all the lines Joan's given me. So, I don't even want you thinking about you using that little machine on a picture of me. I will end you.
But they said no.
Absolutely not. Whoever said that was a smart person who wants to keep getting fed. So, what are we going to talk about next? Lips?
The next thing are lips. So it seems like everybody over the age of 17 or 18 in Hollywood are getting their lips done. And
these are mine too, by the way.
And people are coming out with these big lips. And how can you tell if they are fake or real? I mean, there are people who have large, luscious, full lips that are real.
I have pretty big lips. I'm happy with them.
Well, exactly. And we're going to show you how you can tell. So, number one, what we look at are what are the normal proportions of a lip. A lower lip should be 1.5 times the size of the upper lip. That's the big thing to remember.
No kidding. There's an actual ratio.
Exactly. So let's take a look at a picture. This is a patient who's not had anything done to her lips.
She has good-looking lips.
Exactly. And that lower lip is 1.5 times the size of that upper lip. And that's a normal ratio. And that's how you know that even if somebody comes in and they have nice full lips, if that ratio is the same, it looks nice and natural. So when that ratio is changed, some surgeons will actually over-augment or add too much to the upper lip, and it creates that kind of duck lip type of look, or what we call a trout pout, basically.
A trout pout. Is that another real technical?
That's not so technical.
That's just a couple plastic surgeons hanging out.
But when doctors actually make the upper lip too big, it looks somewhat unnatural because those natural proportions are not balanced.
But some people like that look.
Some people do. Yeah. And actually, we've got 2 examples of celebrities. One that has admitted to having injections in her lips is Lisa Rinna. So let's take a peek at her. Now,
Lisa loves having a super full upper lip.
Exactly. And this is Lisa Rinna before anything.
Look how beautiful her lips were to begin with.
She looks great. Exactly. And you can see her lower lip is 1.5 times the size of her upper lip. And that's why it looks nice and natural. So then let's take a peek at her now. And now her lips are very different.
But she loves that. She likes that nice big pouty thing.
Exactly.
Again, I think you got to go with what makes their head
And it works for her, and she's a beautiful person. But that's why you can, when you look at her, you can tell, okay, it's probably not natural because her upper lip now is actually bigger than her lower lip. Okay.
I see. The ratio is off.
Exactly.
So that's the biggest tell.
Yes.
Well, what about somebody like an Angie Jolie?
Well, that's the next person we're going to talk about.
Okay, because I think her lips, I've been watching her since she was a kid.
Exactly.
In movies.
Yeah.
Yeah, oh, she's so pretty.
So if you look at Angelina, Angelina is keeping it real because you look at her and her lower lip is 1.5 times the size of her upper lip. And that's why she looks natural. So not everybody who has big lips in Hollywood have fake ones. And so she appears, from everything I can see, to be keeping it real.
You were here one other time, and remember when you put that substance in my hand?
Yes.
Tell them what else people put in their lip. They don't just get injections. Tell them what they put in there.
Well, that's what we're going to cover next, okay? So the next way to tell if somebody's had their lips done is the kiss test. So what is the kiss test? Well, it's what you think. It's when you kiss somebody, if they fail, instead of it feeling like you're kissing lips, it feels like you're kissing a rubber tire.
Yeah.
Okay? So how do you fail the kiss test? Well, it all depends on what you use to augment the lips. And the thing that I showed you before was a type of cadaver skin that some people will use to actually put into the lips.
In their lip.
Yeah, kinda
Rolled
gross.
up dead people's skin. Yeah, I thought so too. How would you like to hold it?
It was sterile, so it's okay.
It was sterile. You were wearing gloves.
I was. Okay, well, this is one way that we augment a lip, and this is a silicone implant. And you can take a feel of it. Don't worry,
no,
it's not out of the body.
It's not out of a body.
I swear,
this
yeah,
time.
yeah. So you can take a feel, and it feels kind of firm. It feels kind of rubbery, right?
It feels like an orange rind.
Exactly. Now you put that in the lip, and the lip is going to feel kind of firm and unnatural, and that type of person is going to fail the kiss test. So that's one way we do it.
Nobody's going to be kissing you. You got that.
Another way we do it, and the most common way now, is to use an actual filler. And this is an injectable, okay? And what we can do, I'm just going to put it right here on this plate. This is a filler that we can inject lips with, and it is a temporary injectable, and basically we inject it into the borders of the lip to try to enhance it. And if it's done pretty conservatively, it can actually feel pretty natural. So go ahead and you can take your finger and see. It's almost like, you know, kind of granular, soft feeling. Now, the thing with this, though, is if you overdo it, you can fail the kiss test, okay? So as long as it's done tastefully, you can probably pass that kiss test.
You can probably pass it, but if you overdo that, it'll look like you got a bunch of bug bites. Still,
exactly.
Right?
Yeah, exactly. Now, the final way, the only way to 100% pass the kiss test is to use fat. And this is a syringe of human fat, okay?
Oh, Lord.
And
do
what
they
I'm
at
going
least
to do,
use their own, or they take a stranger's juice?
well, you have to use your own. And I'm going to go ahead and we're going to put a little bit right there. And I'm going to give you a glove right here.
At least he brought me a glove.
Yeah, it's a glove. And there's no holes in it either, so don't worry. But take a feel, and you can feel this is the only way.
It feels exactly like what you think it would feel like.
And
disgusting.
that is the only way to 100% pass the kiss test.
Ugh. I don't want to kiss that either.
So,
Okay, now what are we going to do?
Now we're going to go to the surgery that people have accused you of having, and obviously you haven't.
The brow lift.
I've looked for the scars.
Yes,
we're going to talk about that.
I don't have any.
Exactly. So how do you spot if somebody's had a brow lift? Well, first of all, what is a brow lift? A brow lift is a surgery that we do to elevate the brows and to make somebody look more refreshed and awake, and sometimes it makes people look surprised if it's overdone.
Woo!
Okay. So what they do is they take pictures of you when you're, hey, and then they say,
they go,
look, she's had a brow
yeah.
lift. Yeah. Well, the first sign of a brow lift is an unnatural dent, and usually it's right between the eyebrows. And if we take a look here, this is a picture of one of my patients, and this is her before at the top and her after a brow lift. And what can happen is, now she looks nice and smooth because she's one of my patients.
Yeah.
And what can happen, though, is right in this area, surgeons will actually remove muscle. The muscles that cause you to do this create that what we call Levin sign. Yeah. And when they remove it, in this area, you can get a dent. And that's one of the signs of a brow lift. Okay, and I see no dent in your face, so that's one sign that obviously you haven't had it.
Dent-free! That is fascinating.
So that's one thing. Now
What about also, you said this scar would be up here.
So now the major sign of a brow lifter is the scars. And the old style brow lifts will create two different types of scars. The first scar literally goes from ear to ear all the way along the scalp.
Oh my God.
Okay?
Ow.
And your hairdresser will know for sure because they're the ones that see these types of scars. But there's another scar that actually goes right along the front of your hairline. And we have a picture of somebody who has this scar. And you can
Doesn't
see
that
there's a
hurt
scar
a lot?
right there. Can you see that?
Oh, yeah.
Yeah, and it's usually somewhat well hidden, but the problem is that it makes the hair almost look like it's a helmet or you're wearing an Elvis wig.
It looks like you're wearing a hairpiece.
Exactly, when you're not, and it's because you have that scar that extends right along there. So these are really all the things that you need to become a plastic surgery
Now
detective.
we have all the tools to go out and detect. Thank you, Dr. Young.
Thank you.
Great job as always. Travis Smith will be right back.